I remember waking up at like 3 a.m. And all I could hear was all of the things that have ever been said, that women living with HIV don't deserve to have kids.
Oh, God.
I just remember thinking, like, I just remember feeling like, oh my gosh, they were right. Like,
No.
and stigma is the thing that I think has surprised me at every corner.
At what point in your HIV journey did you feel the most vulnerable, and what did it teach you about caring for yourself?
I remember going to university, and it was going to be like kind of my first move away from home.
Yeah.
I went to a different city. So I remember just feeling really worried for the first time about how I was going to handle this huge part of me away from home, away from my team. The pharmacist was just amazing. I remember going to the hospital pharmacy to pick up my medicines for the first time, and she'd put them in a H&M bag because she knew that I didn't want to explain it to my flatmates. And it was such a basic, small thing in a sense. Like, I was just picking up my medicines, but someone had gone through the care and effort to think about stigma.
Yeah.
And like, it just, I felt so seen.
Yeah.
Being in a new city, you know, with a healthcare trust that, like, I wasn't even going there. Like, they didn't really have to do anything. But it really taught me about the importance of speaking up when I struggle.
Yeah.
And I think I've definitely carried that nothing is too small to say, hey, I'd like some help with this. So yeah. Describe a moment that forged your commitment to your work and why.
Oh, God. There's like just a couple that I met, and she was diagnosed in pregnancy and diagnosed late, and just supporting her through that. But do you know, the thing that I never forget was her husband, right? So she had just delivered, and he had gone through, you know, the counselling and testing, and he was negative. And he was in the corridor crying, and he said, I just wish she knew I loved her. How can we show her that this is not the end? And I mean, at that point, you know, you're trying to breathe, and, you know, going to the toilet, I was just streaming. You know, it's all over. It's all over. But I remember then going back and just helping her navigate, and just seeing the difference from someone who had all these negative emotions about herself and life, and then to see her now thriving. That was a defining moment. Yeah.
Wow. Powerful.
Yeah. If you could go back in time and give yourself advice, what point in time would you go to, and what advice would you give yourself?
Probably to the day that I was told about my HIV. The one thing that I really took home from that conversation was, clinically and like physically, this wasn't really going to have an impact necessarily.
Yeah.
Because I could live a long, healthy life and all the rest of it. But that stigma would be the thing that will just...
Yeah.
And because that day, it was the first time I'd heard about HIV anyway, I was like, it doesn't even make sense. Like, it's a medical condition. Like, obviously the most impactful thing is going to be the physical stuff. But stigma, and particularly self-stigma, that's the thing that I wish I could go back and just say, be prepared, have support, make sure you're checking in on yourself and others around you, because that's the thing that I think has been most difficult. I had a miscarriage earlier this year, and I remember waking up at like 3 a.m. and all I could hear was all of the things that have ever been said, that women living with HIV don't deserve to have kids.
Oh, God.
I just remember thinking, like, I just remember feeling like, oh my gosh, they were right. Like, and it's funny, looking back now, I'm like, that was so, I don't want to say silly because I don't want to trivialize it. Like, it was so real. But stigma is the thing that I think has surprised me at every corner, and would be the thing I wish I was more prepared for. That's the thing that over everything else is like the scariest thing to deal with. So yeah.
It took me, how many years? 9 years to get pregnant. And I went through many miscarriages. And part of me is just that pain of feeling what you went through. And part of it is just how much I hate stigma, because already, you know, when you do go through miscarriages, you just feel you failed as a woman. Yeah. Do you know what I mean? Like, and then on top of it, you know, the stigma, and it's just like, you just hate it, because why is that put onto you? Do you know what I mean?
Yeah.
Yeah. It's hard.
Yeah.
Yeah.
When it comes to caring for your patients, what do you wish you could do but can't, and why?
You want to remove those feelings that people have about themselves that are incorrect and painful and kind of manifest in really subtle ways, in the language that they use about themselves or the language about the future. It's the internalized stuff that people bring to the forefront in conversations, and you can begin to see where it's coming from, because you can't say that you understand it completely because you're not living it, but you begin to see where it's coming from. And there's only so much you can do. You know, I can offer treatment that we've decided on together, and I can do referrals to, you know, like social prescribing and getting things done, but I don't have to live the life. Do you see what I mean? And I don't have to deal with, you know, I always say to patients, I'm not there at 3 o'clock in the morning where you get up and you've watched something or someone said something and it's taken you till 3 a.m. to really process it. I can't be there. And so those are the things that I'd want to remove, just those feelings. Yeah. What is the greatest thing that has made or would make treating HIV easier for you?
Doctors are very much about, they want to get their patients from A to B, ideally in a linear fashion, right? Like, you kind of don't want any setbacks, you don't want any curveballs. When I think about sort of my medicine journey, it's, just been something that I really struggled with, you know. I've always really struggled with. I mean, taking medicines every single day for a condition that, you know, is thankfully manageable with treatment. But, you know, medicines have side effects and all of this stuff is, you know, it's not an easy thing like popping a paracetamol. And I think there's often these, expectations that like once you're on track, you're going to be on track.
Yeah.
And it feels really hard to then come back and say, hey, I said that taking my medicines was going really well. Well, now it's not. This leads me to my answer, which is that choice is what makes it easier.
Yeah.
Just knowing that I have options and I have choice.
Yeah.
And I can always pick up the phone and say, this isn't working for me.
Yeah.
And the team will move heaven and earth to make sure that something changes so that it does.
What would you say to a person living with HIV who says they are afraid to ask their healthcare professional about what they want and need?
I get it. I think, so I have appointments twice a year, and I think I usually feel like, oh my gosh, I've got to cram like 6 months worth of content into this, tiny update. When I'm, asked like, how are you doing? How is everything? It's really hard to do that without trust and a relationship, and that's the biggest piece of the puzzle. I completely understand that anxiety, and I would say just be totally honest with your team if you can be, because they've helped me so much to feel at home, and I love going to see them now. But I remember how scary that first time was, and I know that a lot of people can feel that way.
That's something that people need to hear, because you make an assumption that when people are coming to see you as a doctor, that they know that I'm for them, like, because that's why I'm there. But as you say, you don't know. You've got to be told and made to be assured about that. Yeah.
What would you say to a physician who says they don't have time to talk to their patients about what's happening outside the examination room?
I would say that sadly, you're not fulfilling what you're meant to do as a physician, because we see a snapshot of what goes on in people's lives in that consultation. And like you say, so you're going in 2 times a year and you're having to cram in 6 months worth of emotions, interactions, all this time in 10, 15 minutes. And so if you do not try and understand what is someone's lived experience outside of that room, then you can't know the best way to care for them. And like I do work in, a lot of my work in engagement in care, and what goes on in that consultation is actually tip of the iceberg. That person could come in, look fantastic, but they've lost their house, they've broken up with their partner, their children have gone wayward, they can't find them. You don't even know anything, or their best friend isn't speaking to them. And all of that then could determine just how they live and whether they're thriving, but also it could affect how they take their pills later on or what goes on. So so I would say that it's our responsibility to understand. They may not want to share it, and that's fine, but I think you've got to create an atmosphere that they feel they can, so that if they don't even do it then, they could, ask for a telephone appointment or come in a bit earlier for their next appointment to say that this is going on. So, yeah. What do you feel you are learning from your journey with HIV? Gosh.
Babies born in 1998 who were born with HIV, many of them didn't make it. It's such a gift to even be alive. I feel so aware of that I feel like duty bound to make the most of each moment. And that doesn't mean that I have to be joyful and happy and smashing it all the time, but just being so aware that to be present and alive is a gift just means that I've then had that support that's enabled and empowered me to show up fully in as many moments as I can. What is your greatest hope for me?
How you shared yourself and how you've opened about yourself, and what drives you, just for nothing to change that. So 20 years we're doing this again, and then you said the same thing. You've got your family, you're talking about everything that you've done, and you've just still got that vibrancy. That's my greatest hope.
Thanks.
Yeah. Oh. So if we never meet again, what's one thing you never want me to forget?
How important those appointments, phone calls, interactions are for people, and that those can shape them and stay with them forever. And in the hustle and bustle of the different systems and structures you have to navigate, that don't ever forget that this is that person's life and whole journey, and you get to nurture and shape that. And that's a really big responsibility. But I'll see you next week so I can tell you more. But yeah.
No, that's really, but it's, yeah, it's responsibility, but it's a privilege as well.
Yeah.
Yeah, it really is. Okay, I won't ever forget.